All right, well, welcome everyone to episode 3 of Talkin' Teeth with Dr. J. Thank you everyone for being here. So the way I'm going to try to run these is I like to share some knowledge and information, and so I put together a little bit of a presentation for each one of these Q&As. So I'll try to keep it pretty short, but I like to have something that people can use as a resource later and actually learn something and hopefully become more of an expert with each one of these meetings. So today's topic is, it's an overall topic on dental implants. So last week, all of the questions were basically, not last week, last month, all of the questions were about dental implants and ceramic dental implants. So I was explaining them to people and trying to bring up pictures and stuff. So I figured, okay, well, next month I'll do a whole presentation on them and hopefully clear up a lot of the confusion and a lot of the questions around this topic. So I'm going to do it just broadly on dental implants in general. So I'll take you through the titanium dental implants and kind of the evolution of those and some of the issues and why now we're doing the ceramic dental implants. And yeah, so I hope you guys enjoy it. So when we talk about implants, we're really talking about replacing lost or missing teeth, right? So if we just talk about dental implants, because it kind of doesn't mean anything, the reason why we're even talking about dental implants is because we have this issue in our world of tooth loss. And that can be anywhere from missing a single tooth, like the picture on the upper left. And I actually went through that similar situation. I had my own tooth. I got hit by a baseball bat. And so I've been through all that treatment myself. And then you can have complete edentalism where people are missing all of their teeth. And the reason I pulled up these pictures is because you probably have seen this type of look before, where if someone who doesn't have teeth, maybe it was like an older family member or something that had dentures, if they didn't have their dentures in, then their face looks smaller. It looks collapsed. And so when you see these collapsed lips and you see these big crease lines in the corners of the mouth, that's a sign that somebody has lost some or even all of their teeth. And the reason why their face starts to collapse is because the teeth provide structure, and when you bite, your teeth stop your jaw from closing more. And when you lose teeth and your bite loses that stability, now your jaw doesn't have anything stopping it when you close, and it just keeps going and going and going. And then you get the collapsed look of the mouth and the face. So it's something that when someone's lost a lot of, look older because their face starts to collapse. And so there's many reasons why we like to replace teeth these days. And so I'll go through some of those. And I just like this picture here. Why are teeth so important? Because even though he's missing an eyebrow, the first thing you notice is his smile. And it just goes to show, like this picture, I think it's perfect, because the first thing you notice is the missing tooth, and you don't even notice the missing eyebrow. And so this is one of the reasons why people want to replace missing teeth, because it's so noticeable and it affects your smile and it affects your self-confidence, not just not being able to chew, right, or bite into things. So we call this edentalism, and there's partial edentalism, where it's one or some teeth, or complete edentalism, where someone's missing all of their teeth. And I used American statistics, but 36 million, roughly 10% of Americans do not have any teeth, and 120 million Americans are missing at least one tooth, and that's roughly 35% of the population, and that doesn't include wisdom teeth. So those stats are considering the functional teeth, and they didn't consider wisdom teeth as something functional, which if you have impacted wisdom teeth, they're not really in there functioning. By the way, the meeting last month was all about wisdom teeth and the wisdom tooth cavitations that we treat. So the negative impacts of tooth loss, they include loss of function for chewing and also for speech. If someone's missing one or several teeth, it even affects the way their speech sounds. And if you think about where your tongue goes when you say the word like the or t, you're putting your tongue up against the back of your teeth. Or even if you say 66, the S sound, you're using your teeth to come together. When someone's missing teeth, they can't make those sounds, so it even affects speech. And then the compromised structure, which we already discussed, and then the cosmetics and the appearance, which can affect people's confidence levels and self-worth. Okay, so I'm just going to quickly show this article that I wrote. All right. So I wrote this article like 2 years ago, and it just is a clever little way to illustrate the different options for missing teeth and how to replace them. So we've been trying to solve this problem of lost missing teeth, replacing missing teeth for thousands of years. So this is an example of an Egyptian skull and the fancy things they did to replace missing teeth there. Then there's the famous dentures, wooden dentures that George Washington wore. So that's the president of the United States around, late 1700s. He wore this in his mouth. So that's the most prestigious person in the country. Those were the teeth that he wore in his mouth. And now in the 21st century, we have a lot more sophisticated methods to replace teeth. So I always like to show those earlier versions because I like to just tell patients, look how lucky you are to lose a tooth in the year 2025 when we have all these amazing options for tooth replacement. It's not really a big problem anymore. We can replace teeth really well without much consequence. So the simplest way to replace missing teeth is with something called a flipper. This is just this little acrylic plastic prosthetic that you flip in and out, and that's why it's called a flipper. It's cheap. It replaces the tooth from an aesthetic standpoint. It's not that great in terms of function. You can't really bite into things that well with them, and food gets trapped and stuff. But there are cheap options out there for people who need that. A lot of times, hockey players will have something like this because if they're still playing hockey, they can't really get the permanent long-term solution, because if they get hit with another puck in the mouth again, it's going to destroy everything and it's going to make everything worse. So they a lot of the times have something like this until they stop playing, and then they can get their teeth replaced properly. Then we have dentures. So there's complete dentures. We kind of touched on it before. And then there's partial dentures. So that refers to the complete or full edentulosum and the partial edentulosum. So with something like this, you can replace a couple of teeth or several teeth. And then something like this, you can replace all the teeth. And then we move into bridges, where you have a tooth missing in the middle here, and then you shave down the teeth on either side in order to accommodate a piece of porcelain that's all one piece, and then it cements on over top and you replace the one that's missing. We still do this sometimes, and I'll have situations where someone's doing their whole mouth and they're missing a tooth, and we're already going to be doing crowns on the teeth on either side, and so they save a little bit of money by doing a bridge like this instead of putting an implant in the middle, or maybe you don't have enough space for an implant. So this is still done here and there. Then we get these little things called Maryland bridges, where you don't shave down the tooth on either side. You just have this little wing and you glue it in place on the side of either tooth. And now we get into the implants. So we've got titanium implants and ceramic implants. So implants, you actually replace the root of the tooth. So you have a tooth over here with the root in the bone, and where the tooth is missing here, we put a screw, either titanium or now ceramic, into the bone, and then once it heals, you can attach a tooth onto it, and you've permanently replaced that missing tooth that's lost. Here's another diagram of what this looks like. So, I go over this because people don't know what these things are, and you just hear about implants, and you don't know what's the tooth part, what's the root part. So this is how these things work. You've got the implant itself replaces the root of the tooth, and then you fix a crown on top of the implant, and then that replaces the tooth part that's actually in your mouth that you chew with, that you see. So it's those two components really. Okay, and then we've got the ceramic implants, and I'm going to go in detail on both of these things, but hope that was helpful there. Let me just go back. Okay, so if you want to look over this yourself, you can just go to canadabiohealth.com/replace, and then you pull up this article. So when we're replacing teeth with dental implants, it's the closest thing that we can currently get to today to mimicking nature, recreating nature, right? Teeth were created by nature or God or whatever you want to believe. And when you lose a tooth, we're doing the best we can to mimic nature. And so these things have always been evolving. That's why I like to show in that article where we came from and where we are today. And these things are always improving. So for the longest time, titanium implants were the best thing to mimic nature, and now we have these beautiful ceramic implants, and currently today in 2025, this is the best way that we can replace natural teeth. And that's not to say that sometime in the future there's not going to be something else that comes along that's even better. It's the ceramic implant is the best technology we have today for tooth replacement. There's lots of talk about regrowing teeth and stuff. There's a lot of limitations with that, so I think it's going to be quite a lot of time before that is a clinical reality. But yeah, I like to make this point that we're always improving in our technology and our materials and our techniques, and so where we're at today is amazing, and it's better than where we were at 20 years ago, and in 20 years it's going to be even better than where it's at today. These here are one-piece ceramic implants. So today you're going to learn about one-piece and two-piece ceramic implants. These are one piece, so it's one solid piece of ceramic. Zirconia is the actual material, the name of the material, and it goes straight into the bone. And then the beautiful thing about is that the gums form a very nice attachment to the material, and it seals it off. So it seals off your mouth from the inside part of your body. And we're going to talk about this and how some of the other implants didn't do this so well. And it leaves openings or gaps for microbes to get in from your mouth down in below the gums. So you can see here, this is a very nice seal, and we've really beautifully recreated the natural arch form. So this is an arch of the gums surrounding a tooth, and we're trying the best we can to mimic that and recreate it, which in this case, it's a beautiful example. And if I were to blow like a strong jet of air with my instruments here, the gums wouldn't move. So if they weren't attached, so in situations where the gums aren't attached, you see the gum just flap open. And so there's a pocket, there's an opening there. These are sealed completely around the implant, so nothing can get in below the gums. And that's a huge advantage, and we'll get into it. Okay, so here's another diagram of the evolution of implant dentistry. So they kind of started in the 1980s, and they were just titanium, and no titanium implant is actually pure titanium. They're always alloys, so they're usually between 90 to 95% titanium, and then 5 to 10% other metals. And the most common is titanium, aluminum, and vanadium. if it's pure titanium, it doesn't have the right mechanical properties. And so they have to make them with alloys so that they're the right strength and have the right mechanical characteristics to do the job. And so, you know, that's one of the misconceptions with titanium implants, is that they're pure titanium and that titanium is totally biocompatible. Well, the thing is, even the most up-to-date and the newest titanium implants today, they still have aluminum in them, and aluminum can cause a lot of sensitivities for people. So you have people with metal allergies who, for example, can't wear certain jewelry if it's not pure gold, for example, and they get a reaction to it. Well, someone like that might get a reaction to the alloy of the dental implant, the metal alloy. So this is an important thing that's kind of been left out over the years. Then we improved a little bit, and so the implant remained titanium, and then we started making these ceramic or zirconia abutments. So you can see that word zirconia right here. So I'll show you an example of that. These actually work really well. It's the best way you can do a titanium implant, and you can still get that seal of the gums that I was talking about before around this area to seal off the mouth. And then zirconia implants. Oops. Zirconia implants were introduced around 20 years ago, the earliest versions. And there were some issues with the earlier versions. So zirconia implants have a mixed reputation. If you go to dentists, they'll know about them and they'll say, yeah, but they have issues. And so that's not incorrect. They're right. These earlier versions of the ceramic implants did have issues with strength. And so we saw some fractures, and so it kind of scared a lot of dentists away from them. And that's why today the titaniums are still by far more popular. But around 2015, they came out with the first iteration of these improved ceramic implants, and then 2019 is the current iteration that we're still using today. And they, in my opinion, solved all the problems with the earlier the earlier ceramic zirconia implants. And so now they're actually stronger than a titanium implant. And so you've got the one piece, the first one here, and then you've got the two piece here, where I'll show you how they all work. Okay, so let's go over some titanium implant cases so you can see how they work. This is a case where patient had a bridge, like I showed you before, and the teeth snapped off. Whenever teeth have been cut down so much, they get really weak. And over time, with all the biting forces, and even this guy grinds his teeth, you can see how much he's worn down his teeth. They just give in to those forces and snap. And then the patient comes in and they've got the bridge in their hand and their teeth are broken like this. So these teeth aren't really fixable. If we were to fix these teeth, they would probably break again in the near future. So we take the teeth out, and then these are the drills that we use to make a preparation in the bone to which we're going to insert the implants. And then you can see the implants way down in there below the gum, and that's how you got to do it, because the implant is metal and you want to hide the metal. You don't want to see the metal. So I'm going to go over that. And then you can get results like this, and they look really great. And so, you know, I mastered this between 2016 and 2022. I did probably more than 500 of these, and I got as good at them as you could get. And so that kind of illustrates how that works. There are two main categories of implants, whether it's titanium or zirconia / ceramic. So earlier implants, they were called tissue level. And what that means is you've got the implant you can see here. Hopefully my mouse is showing up. And then it had an extension, and it's all part of the same implant that came up to the level of the gums. So the connection is at the gum level, okay? The problem with that is that you have this problem with metal, and then you end up seeing the metal. So I'm going to show you some cases where you can see the metal. And so the industry progressed to this style, which is called bone level, where the implant gets placed way down at the level of the bone, like you can see here. And in this diagram, it would be down here. And then we attached the teeth into it, and that was done to hide the metal. So with the tissue level implants, you have an aesthetic problem because you can't hide the metal. So the solution was bone level implants, place the implants deeper, but then it created a biological problem because with the implant being deeper, now you have this gap from the mouth that goes all the way down to the bone level, and bacteria and microbes can get into that gap. And so you've traded an aesthetic problem for a biological problem, and you've created this entryway from the mouth inside the body. And we see quite a bit of inflammation, and I'll show you some statistics on that, on these bone level type of implants. Whereas the tissue level, you get that attachment of the tissue that I was telling you about. So this is a study that just reviewed a whole bunch of titanium implant cases and was trying to determine the amount of inflammation that we call peri-implantitis or peri-mucositis around implants. And so it's between 22 to 43% of titanium implants out there will show this inflammation of the gums. And that's a lot. So like, patients are coming to you and you're going to replace a tooth for them, and they're expecting it to last, and hopefully 20 years or maybe even longer, or hopefully the rest of their life. But in reality, 20 to 40% roughly are going to have a problem with it. So, when I started doing a lot of these, I did more than 500 of them, and I saw problems. Like I saw ones that didn't have problems, but I also saw a good amount that did have problems. And so it always sat in the back of my mind of, like, am I doing something good here? Am I doing something that I would want for myself? And then I got to the point where I was like, you know what, I actually wouldn't want one of these for myself. And that's what led me down this whole journey of the biological dentistry in the first place. So you can even see this now being reflected in some of the messaging with some of the titanium implant companies. So they're acknowledging that these problems exist. So we talked about tissue level before. So they're coming out with these tissue level systems again, because there's so many issues with this peri-implantitis, the inflammation around the implants that I was mentioning. This is a big problem in the dental implant industry. So they're trying to find all these solutions. They're going back to these tissue level implants, which were the original ones, because they have less of this problem. So you can see the messaging, iconic tissue level, takes into account key biological principles of hard and soft tissue healing. That's what I was mentioning. And peri-implant health preservation, reduced risk of nesting bacteria. That's what I'm talking about with the gap. Optimized cleansability with the connection at the soft tissue level. And so yeah, it's just kind of interesting to see even the titanium side acknowledging that this is a problem. So here's another case. You can see the implants are down below the gum here, but in this case, they're not deep enough. And so I got this case from a local oral surgeon who placed the implants, and then I was putting the restorations on them. These are the temporaries, and they actually look really good. I was really happy with them. There's no metal in the components of the temporaries aside from the implant itself. And then these were the finals that I got back from the lab. And so we've got another titanium component that goes in, and then we cement the crowns over top. And you can see it doesn't look very good. You can see all this grayness in the gums, and it's because the metal is showing through. And so this is one of the biggest challenges that we had with titanium implants is, how do we hide this metal? And that's why in the other case I showed you the implants were so deep, because we are trying to bury them so that you don't see the gray showing through. Here's an extreme case, and you can kind of compare this. This is one of these tissue level implants, and this is what I was saying, that you can't hide the metal if your implant is not deep enough. So this case demonstrates, like, this is before I got into the ceramic implants, and it's the best job I could possibly do with a titanium implant. And I'll show you what that looks like. Here is the implant healed. It's another one of these situations with the tooth broken off of the gum line. We see this all the time. It's so common, especially with teeth that have been shaved down like this for crowns. These are all crowns here. They just get weak, and over time they snap. And so there's the implant. Here's the implant in the x-ray, and then this is the implant in the mouth. And you can see I've placed it quite a bit deep to hide the metal. And then we've got a couple of millimeters of gum tissue coming out above it. And then I'm going to actually aggravate the gums a little bit, create a little bit of bleeding. And then that's what I've done. Just used a little bit of one of these diamonds to scratch up the gums to cause some bleeding. And then I'm going to take my ceramic tooth. So it's got a metal component, but then the rest of it is ceramic here. And that's going to be in that gum area. And then I'm hopefully going to get, because I've aggravated the tissue, it's going to induce healing. And that tissue is going to regenerate and remodel, and then hopefully give me a nice firm connection to this zirconia material. And then that seals it off from the mouth so that bacteria, microbes can't get down into the bone, like I was mentioning. So my first piece goes in, and then that's what it looks like. And we screw it in. So these titanium implants, you always screw in the components. And then we try in the crown, and then we'll cement the crown in place. So that's the crown with the zirconia abutment. That's what we call it underneath. And then that's how it looks in place. So this is my implant. It looks good. The tissue looks nice and healthy. You can see actually the tissue on the other tooth, which has a metal crown, has a little bit of inflammation here. So that's something we look for, is just, what does the gum quality look like? If you see some of this redness, like a band of redness, you know there's inflammation there. And it could be for a number of reasons, but sometimes it's a reaction to the metal from the crown or restoration that's there. And there's me and the patient. She was very happy. This is a handy little document that I can make available to the group, but this is something I made for dental hygienists to know how to properly clean around implants. So this applies to the ceramic implants or the titanium implants. And what I'm trying to illustrate here is that this area of the gums that I'm trying to get to attach to the implant, like I was showing, I don't want anyone, whether it's the patient or the hygienist, going in there with anything, because it's going to form a seal, and then anything that goes in there is going to break the seal. So that can be floss. It can go in and it can cut the gums, or one of the probes that the dentist or hygienist use to poke in there and measure the depth, or the dental cleaning instruments, the scalers. The hygienists tend to like to dig in there and really clean it out. And I tell them, for around dental implants, no, just don't go below the gum. There is a protective seal there, and I want to keep it intact. And if you go in there with anything, it's going to disrupt it, and then bacteria can get in, and we can see issues start. So these 2 pages here are part of a handout that I make sure all of our hygienists have. And then I even, if a patient's traveling to see us for the surgical treatment and they're going back to wherever they're from, I'll give them something like this so that they can take it to their office that they get their teeth cleaned at. Okay, and some of the other problems that we see with metals in this biological side of dentistry is that there's some toxicity with metals, and we talked about how it's not pure titanium. It's got sometimes nickel, sometimes aluminum in it. There can be corrosion that we see where it's like a rusting process where the metals just start to rust. And so it's like this boat propeller over here where you see corrosive process, same thing. And then there's this whole topic of EMFs, right? So we've got 3G, 4G, 5G, Wi-Fi everywhere. We're always surrounded by all these electromagnetic frequencies, and they're called non-native electromagnetic frequencies. The Earth makes its own EMFs, and that would be called a native EMF. And our bodies, our biology is wired for that. It's not so optimized for these artificial EMFs, these non-native EMFs that we're constantly surrounded by these days. And so, we can deal with it, but when you have metal in your body, it acts as an antenna, and it's pulling in more of the wireless frequencies and amplifying them to your surrounding cells. And so that's an issue that we face nowadays, where maybe in the 1990s it wasn't such a big deal. So it's one of the things that prompted me, that when I had my front tooth that I was going to take out, it's one of the main reasons I didn't want a metal implant, is because I was conscious of EMFs. Yeah, this is, let's go look at this quick. So this is my experience going through all this treatment myself. And so I made a web page about it, canadabiohealth.com/journey. And I tell the whole story. There is a 7-minute video I made of the whole experience at the top. So I'll just quickly show you. Hello, we're here for the Swiss Biohealth Biological. So this is when I went to Switzerland. Can someone just unmute and let me know if the audio is coming through on the video?
I'm unmuted.
I can hear it fine.
You can hear it. You can hear the audio.
Dentistry course, and while I'm here,
they're gonna.
Mm-hmm.
Okay. You can mute. Thank you. All right. So this is at the Swiss Biohealth Clinic in Lake Constance, Switzerland, where I ended up going for my treatment. And I was in the course as well. And I tell the whole story. A short version, basically, I met the lead doctor in the US, and then he said if I come to his course in Switzerland, he'll do my tooth for me. So that was quite an amazing opportunity, and I took him up on it, and I went, and I was a doctor in the course, and then I was also the one who they did the live demo with. And so this kind of chronicles my experience there. So here's at the front desk, and then you go in and you get a IV infusion. There's me lying down on a treatment table. I'm getting a head massage, and then there's this pulse electromagnetic frequency device, and then you can see the IV infusion in my arm. This is pre-surgery, and then I went into the surgery, and so this whole experience was so amazing that after I had it, I basically decided this is what I'm going to recreate in my clinic. So we actually just started last week, and we had our first IV vitamin infusion that we did with one of the patients in the clinic, and we're setting it up just like this. And so that's going to be how patients receive treatment going forward. And it's really nice because you go into the surgery, you're a little bit nervous, and then you're so relaxed. By the time the treatment's done, you just go into the surgery and you're not worried about anything anymore. So that's how I felt. It's about a minute here, so we can just go through it. So this is, it gets a little graphic, but I figure you guys are here to learn, so we're going to show everything, right? So there's them taking out my tooth, and it came out really easy. And then clean out the socket thoroughly, and then start preparing the bone for the implant. So you make a little hole in the bone in order to be able to screw in the implant. So they're preparing the bone now. And then ozone to disinfect and oxygenate everything. And then there's the implant. So the implant's going in. And then these are the PRF membranes that they insert. PRF is made from our own blood, and it makes these wound dressings that can go in and help the healing. So there's the implant in position. And they put some more PRF in there, and then shape it down. So this is also one of the one-piece implants, like I was saying before. And then they made an immediate temporary the same day. And then there's Dr. Volz, the one who did the surgery, and then he went in to teach the rest of the course after doing my surgery. So there's the implant. So you can see it's one piece of ceramic all the way into the bone, coming out into the mouth, and you saw the part sticking out of my mouth, and then the temporary crown got cemented over top the same day. So all in one day, the tooth was removed, implant was put in, and the temporary tooth was put on. So I never went without a tooth. I went, well, for like 30 minutes I was without a tooth, and that was weird, and it changed how my speech was and everything. So that was kind of interesting. Okay, so let's go back here. So here is some histological slides that show this tissue connection attachment that I'm talking about. So this is the zirconia and this is the tissue, and it forms a very tight junction with the ceramic, and that's how it seals off the rest of the mouth, which we call the oral cavity, from down inside toward the bone. So the mouth would be out here, and then this is sealed off, so nothing can get down into the bone area to cause that problem I was saying before, the peri-implantitis, the inflammation around the implant. And the beauty of the ceramic is that it's a tissue level implant, but it's white. So it has the benefits with that microbial seal that I was talking about, and you don't have to hide anything because it's a beautiful white material. It's what we're looking for tooth color, right? So you don't have to hide it below the gum. So that's why this material is so amazing, because you get the biological benefits and the aesthetic benefits. So here's a molar area where we extracted a tooth here, and you can see it was done very atraumatically. The gums are all intact. And then we put one of these, this is a two-piece implant now, and I'll explain that, into the position, and you can see how well it approximates the shape of the tooth that we took out. So we're trying to mimic nature, right? And so we want to approximate the shape of the teeth, which we're trying to replace. And then there's the implant shown in the bone there. And that's replacing the root of the tooth, like I explained before. And then later on, we'll replace the crown. And that's the part that we make to go on top that the patient can end up chewing and biting with. Another example here of a lower molar, same kind of thing. Tooth comes out, implant goes in, and then we fill in the gap a little bit with some of those products we were talking about, the PRF, the stuff we make from your blood, and then that will all fill in nicely with new gum tissue. Another example here. Here's the tooth we took out. Here's another tooth that was missing. We replaced them with two ceramic implants and attached. This one's a two-piece. We attached the post to it. This one's a one-piece. And then we made temporary teeth to go in place here. So you can see the part sticking out. This is a one-piece. This part sticking out is the two-piece. It's the post that we cement to connect to the implant. And then we can attach the teeth on top. This is just another little illustration here to show how when we re-approximate the wound and everything, we leave a little bit of space, and then we fill it up with some of those PRF membranes that we make from your blood. And then the body grows new gum tissue, and we actually improve the thickness of the tissue to make it stronger and more robust and more resilient and give a lot of volume. So you can see like where the edge of the implant is, the tissue comes all the way out to here, and then you get a nice thickness, nice quality tissue around the implant. It's very important to have healthy gum tissue around implants. And then you can see here how you couldn't even tell that this was not a real tooth. This is a just diagram of the PRF. So this is what we do with surgeries. We draw blood from the patient's arm, spin it in a centrifuge, and then it makes these gels. So that's totally from the patient's own blood. Those are the white blood cells, which are concentrated, and they make these gels, and then those are what we use to put around the site to enhance the wound healing. Okay, so here's another situation. This is the same tooth that I had done on myself, just in another patient. Here's a root canal, which we were taking out. You can see how unhealthy the gum tissue is. It's so inflamed here. So we took this tooth out, which had been kind of restored to death. And there's some restorative material from the root canal that went into the bone. So we're also going to remove that. That's something we're always trying to do, is if there's foreign materials in the bone, we're trying to get them out. We don't want to leave things like that. And I did it in this case too. In this case, you can see there was a piece of tooth left over in the bone, and I was able to retrieve it and clean it out before putting the implant here. You can see the area where that piece of tooth was. So our strategy is always trying to remove things that shouldn't be there in order to help patients with just better healing, not having foreign materials, and just promoting optimal health, essentially. So the way we approached this surgery was we left all the gums intact. I didn't have to make a big wound, but at the top, I made a little cut in the gums in order to get that extra material. It's like a rubber material that was used to fill the root canal that went too far. So we went in there to clean that out. And then same thing like my tooth, like I showed you, implant goes in. Here's a one-piece implant. This is some of that PRF membrane that we've placed in there. Prepare the tooth so that we can put the crown, and then we put the crown on same day. And then this is what it looks like after it's healed for 2 weeks. So there's the implant in the bone, one piece. There's the crown on top. This is maybe 4 to 6 months down the line when it's nicely healed. You can see how beautiful the gums look. All that inflammation is gone. And she's still got a little bit of inflammation here. I think it might be something, these are natural teeth, and she's still got it here. So it can also have gum inflammation from something systemic going on. Like maybe it's a liver issue or something like that. And then here's the final tooth. Okay, so nice example of a front tooth replacing a diseased tooth with a beautiful ceramic implant that's totally biocompatible. And the thing with these ceramic implants is the body doesn't see it as a foreign material. It sees it as something neutral. So it's not saying, hey, what is this foreign thing here? It's neutral to the body. It doesn't trigger the immune system, and it doesn't leach anything. The other thing you'll hear, it's a myth that zirconia is a metal. It's actually not. Zirconium is a metal on the periodic table. When you combine zirconium with oxygen, you get zirconium dioxide, aka zirconia, and it's no longer a metal anymore at that point. It's a ceramic. And so it doesn't have the properties of a metal. It won't conduct electricity, and it won't be an antenna to EMFs, and it doesn't leach any metal. Another example is salt. So salt is Na, sodium, Cl, chloride. So sodium is a metal on the periodic table, but when you combine it with chlorine, you get sodium chloride, you get salt. It's not a metal. So you might hear that out there, and it's just a myth, and it's not true. Zirconium is a metal. Zirconia is not a metal. Okay. So sorry, I wanted to just show there was the before picture. You can see all the inflammation, and you can see how much healthier the gum is now. This is a molar situation again. So now we're using the two-piece implant. So the one piece we generally use when we're attaching a tooth to it the same day. And the tooth is really for show. When you do the implant, you have to wait 4 months for the bone to heal until the bone will actually fuse with the implant and you can start chewing on it. So when we're doing front teeth, we put teeth there, but we tell the patient, hey, this tooth is just for show. It's not for biting or eating. So you've got to be very careful. You've got to cut food up and you've got to eat it, chew it in the back. You can't be biting into sandwiches or burgers or pizza or corn on the cob, none of that stuff. If you put pressure into the implant when it's too early, before it's fully healed, it can actually start to come loose. And so we don't want that. So that's why we use these one-piece implants in the aesthetic area. So you don't have to go without a tooth. So one piece, and then you attach a tooth to it right away. The two-piece, you put the bottom part in the bone and you leave it at the gum level. It's like that tissue level, like we were talking about before. And then it's because it's down low at the gum level, it's less likely that the patient's going to bite into anything and chew down with it. And then when it comes time to, when it's healed and it comes time to attach a tooth to it, then we can attach the post. So we remove this little cap screw there and then we cement the post into place. And then what I've done here is I've used the laser to create the shape of the gums that I want in order to have a tooth that fits nicely in the gums. And then we shave down the zirconia, make it into the right shape, use our in-house milling CAD/CAM technology to take an image of the preparation, and then we make a tooth in the office while you wait, and then we cement it into place. So there's the final tooth or the crown, and you can see it sits nicely into this nice gum formation that we've created so that it fits really well, and then the patient's not likely to get food stuck. We're always trying to eliminate areas where food gets stuck. Okay. And there's an x-ray. So it just shows, you can see the two-piece implant. So there's the post that we connect in place there. And then you can see the crown over top sitting in place. And then this area here, that's all the gums. So gums don't show up so much in an x-ray. So the bone is there, and then all this area in here is filled up with gums. Just another example, there's different shapes of these zirconia implants, and they make them to replace different teeth in different areas of the mouth. So this is called a premolar. So the big molar back here is a regular molar, and then you have a premolar. And so this is a nice oval shape to replace a premolar. Again, we have a two-piece. So here's the area where we connect the post. We shape the gums, prepare the implant a little bit, and then we make the crown to go in over top and fit in there nicely, replacing the tooth. Okay, one more here. This patient was an orthodontic patient, so he was missing his lateral incisors. So the middle ones, they're the central incisor, and then the ones right beside them, they're called the lateral incisors. So this is a common congenital thing. We call it congenitally missing teeth, or in this case, he had congenitally missing lateral incisors. And so the orthodontist opened up the space for us to make enough room for the implants. And then we're going to go here and do some ceramic implants for him. So in this case, because we needed to be really precise, you can see there's not a lot of space between these roots of the other teeth. We need to be right in the middle there. Same thing here, there's even less space. So we made a surgical guide here, so it allows you to plan everything before, plan the position of your implants, and then you've got one of these jigs, and then you can drill into it, and it ensures that where you drill is in the exact position that you planned it. So it's kind of a cool way to show this technique and what can be done. These implants are in place. These are, again, one-piece implants. And then we made temporary teeth to go on top, and then this is 3 weeks later. And so we're trying to start to get this shape of the gums to match that arch form that we were talking about before. So they're still a little flat, but this is only 3 weeks after, and you're going to see how this progresses over time. So after 4 months, these teeth are the same teeth. I haven't changed anything or taken them off. And you can see the gums are starting to fill in and starting to look more like natural teeth. And where are we at here? Okay, so that's where we started. You could see the gums were totally flat. And then a couple weeks later, you start to see it responding. And then down the line, we've now started to get that arch form where it's starting to look really nice and look a lot more like natural teeth. And then these are the finals. So we did a few rounds of temporaries to keep shaping the gums and get them to be the right shape. So, take the temporaries off, shape things out, and then get the final crowns in place. Or these might even be another set of temporaries, I don't remember. But you can see how we're creating that nice shape of the gums. And then here's how we ended up. And, I got a nice message from a friend of his who's one of the dentists at our office that he smiles all the time now and he's so happy. And so it's really cool to be able to do this kind of thing for people and to do it in a way that is also not going to impact the immune system. And you're putting something in there that is a healthy option, right? And I've done this myself, so it feels really good to be able to do something for patients that I'm comfortable with for my own mouth and my own body. This shows here just a situation where we decided we were going to remove some titanium implants for a patient where the implants had that inflammation around them that we were talking about. And this here just shows how we clean the bone. So the implants would have been removed already, and then we use this ultrasonic device. It's called a piezo surgery device, and we clean the bone and make sure it's healthy before we put the new implants in, the ceramic implants. So whether we're extracting teeth or removing that titanium implants, we do this procedure cleaning all the bone and cleaning infection out of the bone and whatever, getting it to bleed really well. So a lot of what we do is just cleaning, treating the bone. We spend a lot of time on that. And that's the big difference from conventional dentistry methods. In conventional dentistry, I never was that focused on cleaning the bone. You'd use a hand instrument, you'd scrape it a little bit, and that was about it. So that's been the big shift, is now I'm so focused on leaving the bone as healthy as possible. And that's how we're seeing patients have these really nice healing responses. And then once the bone's clean, we can go and put the ceramic implants in. Again, we're putting 2-piece implants in this situation because we're not going to be putting temporaries on them. So they go in until they're tight, and then we can close everything up. So this is the day of surgery where we stitch everything up around, and then once they heal, you can see how nice and healthy the gums look around that ceramic. These are all 2-piece as well. You can see they're just down on the gum level. I want to point out, a lot of the ceramic implant companies, what they did is they just copied titanium implants and they made them with ceramic. And there's some issues with that. It's a different material, and so it required a totally different approach. So a lot of the issues with the zirconia implants arise because of they just copied titanium. So the implants I'm showing you today, and the only ones that I use and the one I have in my own mouth, is called the Swiss Dental Solutions SDS ceramic implant. And everything I'm showing you today is the SDS implant, and it's the only implant that I would actually want in my mouth. So there are other ceramic implant companies, and I'm not that big of a fan. So that's one thing. Like, one of the people on this call is in Florida, and I was trying to help her find someone, and I said the number one criteria is you make sure that they do SDS implants. Like, if they don't do SDS implants, then find someone else. Okay, so when we're ready to connect the teeth, then we cement the posts in place for the 2-piece implants like I was showing, and then we prepare the gums, and you can see I've created nice indentations so that we've got a natural form of the teeth, and then we make the teeth to go in place. So that's what that looks like. So Gina, you don't mind if I call you out, but this is the one that's similar to your situation. And so it's almost identical, actually. You can see the gum recession here, and this tooth had an infection. And so we opened it up and I cleaned out all the infection. And you can see there was quite a bone defect here. This is the normal level of the bone that we're looking for. And this is how much bone this patient had lost due to the infection that was in there. And then we made the preparation here for where the implant's going to go. All the bone is nicely cleaned up. Implant goes in, 2-piece implant again. And then we did a bone graft. So this is bone material that we've mixed with the patient's blood or PRF, and we patch up that defect and fill it all in. And then we cover it up with more of the PRF membranes and cover everything. And then we'll close the gums. So you can see that's where the recession was. And I've filled it all in, and the body is going to fill that all in with gum tissue before. So I showed that before in that open healing where I said we leave the tissue a little bit open and then we fill in the gaps with PRF, and then the body fills it all in, and then we get a nice thickness of gum tissue. And this is just a few weeks later as it was healing, and you can see it's all filling in really nicely and that defect is disappearing. And that's the before. So you can see the gum recession here, and you can see it's already filling in only a few weeks later. And then this is later on when we went to restore it, and the defect's completely gone. No more recession there. And we're going to just put a nice tooth into position there. Okay, so I'm pretty much done. This, just wanted to point you guys toward a video I made if you're interested in learning about the options for full mouth tooth replacement or full arch tooth replacement for when people are missing all of their teeth. So I made this video here, and it's 12 minutes, and it goes over all of the different options from dentures to titanium implants to ceramic implants and everything. So if you just search that, even if you just search my name on YouTube, you should be able to find it. But yeah, that's there for you. I just like to always touch on these bone healing concepts on every one of my presentations, because I'm showing the surgeries and I'm showing how they're done, and a lot of it rests in our hands on the technique of how things are being done, and then a lot of it rests in your hands as the patient on what you're doing, what you're eating, what are your behaviors, and how are you preparing your body to heal properly from this trauma that we're inducing, and growing new bone and growing new gum tissue. Your body's got to be in a optimal state to be able to do this well and heal properly, right? So I just pulled this from my website. This is the protocol I use for the biological tooth extraction removal technique, but it also applies to when we're doing cavitations or when we're doing implants. It's all the same. You want the bone to heal, and you want the body to be able to grow new healthy bone. So it's the same concept. So we get into nutrition, optimizing vitamins, minerals, micronutrients, and protein is a big one. And then we help you prepare your body several weeks before the surgery, giving it all the building blocks it needs to build new healthy bone. We call this the bone healing protocol. And then day of surgery, like I talked about, using these different techniques to help the patient be in a more relaxed state. When you're in a stress state, fight or flight, sympathetic state, you don't heal as well. Your body is in emergency mode. We want the body to be in the rest and digest, the relaxation, parasympathetic mode. And then your body can allocate resources to healing properly. And then you just have less complications, less swelling, less pain, all those good things. And, then it's on to us, careful removal of the tooth, taking time, making sure you don't damage the bone, removing the tooth gently, preserving the bone tissue, using the instruments like the ultrasonic that I was showing, so it cleans the bone without damaging it. And then, get into the disinfecting here again, removing the unhealthy tissue, leaving only healthy bone, and then treating the area with things like ozone to kill and sterilize the area. Then we do the PRF membranes, the blood concentrates like I was showing, the wound dressings that we make from your own blood, and just to enhance the healing. what we do with the PRF membranes is it's concentrating your own stem cells and growth factors. And so if they concentrate into this membrane, we put it in there, and now you're just giving the wound area a boost with all the right cells in order to jumpstart the healing process. Okay. Yeah, okay, so that's that. Just want to remind everyone that we have the Telegram group. I think there's like 170, 180 people in there now. So this is the best place to stay connected with this dental community. And that's where I've got a lot of resources posted and stuff. And, you know, there's a chat and all those things. So I just wanted to remind everyone of that. And here's all the info, but I think you guys already know this stuff. And that's it. So we can move on to Q&A. I think I did pretty good. I was just around an hour. That was what I was aiming for. And it looks like almost everyone's still here, so that's good. So I don't know if anyone has any questions today. It doesn't have to be related to the presentation topic, but I just hope that what I covered is illuminating and educational, and, you know, just trying to give you guys something of value. Yeah, Susan, go ahead.
Am I allowed to ask questions about my own specific case?
Yeah, as long as we don't mind people hearing about it.
No, not at all. So I had my 4/6 PP ceramic implant done on September the 9th.
Yeah.
And I had my post-op on October the 2nd.
Yeah.
So should I be booking an appointment to get the post cemented on the implant and the crown made, or am I waiting for Kristen to contact me?
Yeah, we always pen that out, so you don't need to worry. We wait 4 months, right? We let it heal for 4 months before we do the next step. So the post and stuff that we were talking about, that's after it's been 4 months of healing, when we get ready to put a new tooth on it. In your case,
is that 4 months from September 9th or October 2nd, Julian?
from the actual day we did the surgery.
Okay, yeah.
Yeah. 4 to 6, like it's not always, it depends, right? But yeah, generally our general guideline is 4 months. You know, it's going to depend on the rest of your treatment, right? That's kind of what we were finalizing and stuff. So depends if you need anything else, if there's any, you know, any other teeth in the area that need work. Like sometimes we've got to coordinate it with that. So
yes, well, Dr. Robert is fixing the 434445 in a couple of weeks, the cavities, and then that's November 12th, so a week and a half from now, and then a month. I've already had the GBT with Nicole, with the assessment with Robert, and then on the 10th of December, then he's doing the fillings on the lower left, whatever teeth need doing. And then my next GBT with Nicole is February 2nd. So I figured there must be like a coordination of when is the best time to do the final post and crown based on all the other work I'm having done.
Yeah, it's no problem.
And at the last episode, you mentioned that you kind of test to make sure the implant is solid with a pressure gauge.
Yep.
And you torque it and try to twist it. So would I wait till I'm seeing you for the actual appointment, or would you do it when I see, say, Robert in December, when I'm already there?
No, we'll just wait.
Okay.
Yeah, it depends. I always tap it. I do the tap test and I get a reading, and I don't always need to tighten it. If I get a good reading, I don't need to tighten it.
Okay.
So yeah, it's on an individual basis. Okay, so are you good, Susan?
So I don't have to do anything then. I'm just waiting for Kristen to contact me to say, let's book an appointment.
Yeah, totally.
Okay, that's what I needed to know.
Yeah.
Thank you.
No problem. Thank you. Gina, you want to ask a question?
Hi.
Hey, how's it going?
Good. Okay, good. So I have a few questions.
Did you
but
learn a lot?
always. I have a
Did you
few
see
questions.
did you see the one I showed about your tooth?
I did. And that's one of my questions is considering mine is there's so much gum loss in that spot, and I know the tooth has been infected. How much bone loss do you think there is? That it's really bad. That's really bad. Is that what that means? It's really, really bad.
I think yours is pretty similar to the one I showed.
Yeah, that's really, really bad. Is that in a
No,
category?
it's totally manageable.
Would that that kind of bone loss precipitate a necessity to wait at least 4 months prior to putting in the post?
Like I showed, you can sometimes do the post at the same time. You don't have to. It doesn't always have to be. Like it does depend, but a lot of the time you can put the post at the same time, manage with the bone defect, do it all in one surgery.
Okay.
Yeah.
So on another question I have is the so I found a great dentist. I went through like 5 people. Can't found her. She's young, but
Uh-oh.
she's on par. I know she's young. I tell you, but she's on par. Is that, what do you mean? But she has all of the checklists from the ozone to the PRF to the SDS. I did not put on the checklist to ask for the ultrasonic piezo. I thought
Okay.
ozone was the.
You need that for your infection. You definitely need that.
So I have to ask that tomorrow then.
Yeah.
And my other question would be, is that how would you describe that? Just ask for ultrasonic piezo cleaning device?
Yeah, piezo. So the brand is Mectron, MECTRON, but yeah, it's PIEZO, piezo surgery, ultrasonic.
Okay. Okay, fabulous. And
Is this your friend, Giti?
no,
Oh, it is or it isn't?
no.
Oh,
Hi.
it's GG and GT.
Yeah, I know, it's funny. Giddy and Gigi. So yeah, so I guess all in one day they'll just do the what's the difference between a cone beam and an x-ray? What do you see difference? You just mentioned you can see the gum in the cone beam, but in a regular x-ray you do not.
Well, to different degrees you can see gum. Like you can't get details about gums in either, actually. You need a cone beam, like the whoever's doing the surgery should have a cone beam.
Yeah.
Like you need to see the bone in the cone beam scan.
Yeah.
A cone beam is an X-ray. It's a type of X-ray, right? X-ray is just the broad term for all the different types of X-rays. So just a 2-dimensional dental X-ray is what they take just quickly in the room, and it's just one. Like I showed a bunch of them in that presentation. It's just one picture, versus the cone beam is the 3D that you can scan through in all different dimensions.
Do they usually take both, or no? It's always one or the other.
No, I mean you do the cone beam before when you're in the planning stages, and then you usually take the regular X-ray at the end just to check everything, just to see how you did, just to make sure it looks good.
Okay.
Make sure you like last week I did one, and there was some foreign material in the socket, and I had to take an X-ray in the middle of the surgery to see if I got it all, and then I didn't. I still saw some left on the X-ray, then I had to go back in and keep cleaning it. So yeah, different purposes for the different kinds of X-rays.
Okay, fabulous. Piezo, okay. I'll raise my hand again if I think of any.
Okay.
I'll let someone. Thank you.
No problem. Thank you. I don't know how is it GT or Gitty or
It's hi, Doctor
hi.
Julian. This is Geeta. Actually, I have different Telegram. That's why.
Oh, nice.
Yeah.
How's it going?
Good. How are you?
Good, thanks.
Good. That's great. Actually, I had a question about like how important it is cleaning the basically teeth for, because is it like damage the gum?
Yeah,
Professional cleaning, I mean,
yeah,
professional.
yeah. It can damage the gum.
Mhm.
If the person is really good and knows what they're doing, then it shouldn't be damaging to the gum. Let me show you. So we brought in a system at our office called GBT, and
GBT.
yeah, and it's what I like. Where are you located?
Toronto?
Oh, okay. Have you been to our office or no?
Yeah, of
Oh,
course.
sorry. Okay, okay. So did I talk to you about the GBT? Must have.
No, actually, I don't remember. No,
Okay, let me show you quickly. I gotta
GBT.
pull up another. So
I have a quick question while she's looking.
yeah, sure.
What was your journey by bio? Where is that located on your tooth?
Oh, the website?
Yeah, what did you have that under?
CanadaBiohealth.com /journey.
Okay, thanks.
I have a video. This is the problem when
Who took all your pictures? Who did all that?
of what?
Your whole journey. Who's your cameraman? Camerawoman?
Probably my wife.
Yeah, she's good. She's really good. Good job. Good job, Kelly.
Yeah. No, it was good because she was in the lecture hall. Oh, there, I got it. Okay. Okay. I don't even think I asked her to do it. I think she just did it and it ended up being really helpful. Okay, well, here it is. You see my screen?
Yes.
Okay. So the GBT, it's called guided biofilm therapy. And this is the device. So it's another product from Switzerland. And so instead of the old materials that they used to use for cleaning teeth, like this is showing the old methods first. Which can be damaging to the gums. Because the instruments are going in there and they can disrupt that connection that I was talking about. So this new machine just uses a stream of powder and water. This is still the old methods. You can see it go in and they can cause bleeding and stuff, and it can.
Yes, me too, for many years.
Yeah, and then this polishing can be damaging to the enamel and stuff, right? So yeah, you're not wrong. I also don't think it's that, for most people, it's not that big of a problem, but it is real. And so now we're into the new method, guided biofilm therapy. So they use this dye to stain the teeth and show where the plaque is building up. And then it teaches you, it's like, oh, this is the area where I get more buildup. And then there's the spray with the powder and the water. And then that's what's cleaning the teeth. So it's much gentler on the gums and on the enamel. And it does an amazing job cleaning. So that's what we have at the office now. And it feels incredible. Your teeth feel amazing after.
Wow.
And so you see, that's the area that's been stained with the
Yeah.
disclosing agent, and then this, it's like a little power wash, but it's very gentle and it's even warm. So the machine warms up the water, so it's very comfortable and feels nice.
And it cleans the plugs, that's right?
Yeah.
Okay.
So
That's impressive. I mean,
so I always recommend to my patients, like if they're traveling to see me, then I say find somebody that this company's got a directory of the dentists who use it or the offices that use it. And so I recommend my patients go find an office that's using this for their continuing care after they leave me. Yeah.
And is it okay just once a year or 2 times a year, or it's up to the, the situation?
No, like it totally depends on your situation and the health of your gums. So, for example, I had a patient today who he gets more buildup and he gets more problem with his teeth.
Mhm.
He said, you really need to go for a cleaning every 4 months. Like, I don't think you should go longer than, so that's 3 times a year for him. And some people even need more often. They need 4 times a year. But yeah, for me, I would go 2 times a year. That's pretty good. It's more of a, it depends on the person. Like, if someone gets a lot of dental problems, then it's actually necessary for them to maintain things.
Mhm.
If it's somebody that never gets cavities, doesn't have any gum problems, it's more of just a hygiene thing where your mouth feels
Yeah.
cleaner, it feels better. And so do you need it 100%? No, like you can probably go years without getting it cleaning and be totally fine. But it feels nice. It's like getting your hair cut. It's like taking a shower. You just feel cleaner.
That's right. Yeah. So is it like anything that we can do for the like, cavity things? I don't know. They say about the xylitol, using xylitol is because when you have a dry mouth or, breathing, from mouth when you're sleeping can cause cavity and other issues. So like using xylitol after food, like maybe few. What
So
do you
that's a
think?
tool, right? So a healthy body
Mm,
doesn't get a cavity, right? So the natural state of a human is healthy state, and you don't have this problem. Like when your tooth gets a cavity, it means that your tooth is actually disintegrating a little bit, and it's kind of like rotting, right?
mhm.
So if that's going on, it means there's a problem somewhere. And so something like xylitol is a tool that can be helpful to reduce that problem, but you're using it like a band-aid.
Yeah.
So ideally, you figure out the nutrition and the lifestyle. And like you said, mouth breathing is a problem. It can lead to cavities. So like, for example, me, if I put a piece of tape on my mouth when I go to sleep at night so that I don't breathe through my mouth. And then it improves the saliva and everything. Your mouth doesn't get dry. So, I mean, there's different strategies, like depending on what the issue is. There's special toothpaste that help with reducing cavities. Like there's the hydroxyapatite toothpaste.
Okay.
Xylitol is one of the things you can use, but yeah, there's different tools to help with that if that's an issue.
Oh, okay. I wanted to ask a question, but I think I forgot. What about the night guard? Is it
Yeah, what about it?
I mean, is it okay to use it if you have, problem?
Yeah, like some people need it and some people don't. like, do you have a night guard?
I have. I haven't used for maybe, I don't know, 2, 3 years, but usually I had for a couple of years.
And do you grind your teeth?
I didn't notice myself, but the dentist told me based on, I don't know, he looked at my teeth and said, probably you're doing that at night.
Yeah. Yeah, I mean, if you grind your teeth at night, then it can be helpful because grinding your teeth can be damaging and you cause more problems with your teeth. So it just depends. Like, yeah, it's a complicated thing, and it depends on the person. So, if you haven't worn yours in a long time, it might not even fit anymore, right?
Yeah.
So,
Yeah.
but yeah, like I sometimes make night guards for patients. Like, what would be nicer is to address the grinding and try to help the patient figure out, okay, if there is grinding happening, why is it? Is it because there's an issue? Is it maybe sleep apnea? Is it something like that? And a lot of the times we're recommending the patient go get a sleep study, and then you can see, okay, the grinding because they're actually having periods during the night where they stop breathing.
Yeah, that's true.
So, I mean, yeah, it just depends. Like,
Yeah, the root cause.
yeah, and I mean, I'll do a bunch of work in ceramic implants or whatever, and if I know it's somebody that clenches their teeth or grinds, then yeah, I'll make them a night guard and say, look, you probably should wear this at night because you need to protect your implants, otherwise they're going to fail because you're putting too much force on your teeth at night.
Okay.
Yeah.
Thank you so much, Doctor.
Yeah.
Thank you. I
No
appreciate it.
Yeah, go ahead.
Just a quick question. What do people expect after the extraction and the surgery? What is the timeline? Like usually, do you feel like pretty much 3 to 4 days of pain or anything?
It's individual. It depends. It depends how big of the procedure. Like, if it's a more serious thing, like yours, for example, one tooth, after about a week, you should probably start feeling pretty close to back to normal.
Pain? Is there like throbbing pain for a week?
Oh, like maybe 3 to 5 days of like where you find you have some pain and maybe you're taking some painkillers or something. But you might not need anything. It depends. That's like why we're doing with the IVs and everything, because like, for example, when I had my tooth done, I didn't need to take a single painkiller.
Yeah.
So yeah, it totally depends.
Okay, thanks.
Yeah, I would expect around a week.
Thank you.
Yeah, no problem. Hey, what do you think for the topic next time?
Oh, this whole thing? Oh, I had a good idea. Give me a moment.
Susan, go ahead.
I'll get back to you on that in the future.
Okay, Susan, you want to go ahead? Susan,
I
can you hear me?
apologize. I forgot to unmute myself. Sorry.
Oh,
Okay. Sorry. I've done all this talking. Okay. So when I come in after 4 months for my 4-6 crown, do I get a temporary crown and then 2 weeks later I get a final crown like I had in past? Or is it just a
Usually
final-
not. No, we make it the same day in the office now.
Oh, okay.
Yeah.
So it's just one appointment and it's just a final crown, no temporary crown.
Most likely, yes.
Okay. And so I'm still a little bit confused. So if right now my 4 months would be like beginning to middle of January, and
Yeah.
I'm currently scheduled to get GBT cleaning with Nicole on February the 6th, which is like 5 months from the surgery. So is there a better time? Is it better to do the GBT cleaning after the crown is installed, or is it better to do it before? Or does it matter?
It doesn't matter.
Okay.
Yeah.
And do you know when you're going to get Dr. Dom's toothpaste in? Because I wanted to buy it and it's not available.
Good question. I ordered it like in August, and we still were waiting for. I've been having so much trouble with the customs and stuff.
Yeah.
So yeah, I should be getting it. Like I think it's in Canada. It's just
Okay.
like I've had.
Just stuck somewhere.
You wouldn't believe the issues that I have, where like how much time we have to spend on the phone with, customs, like getting them to release a package like that.
Yeah.
So it's so frustrating. Like I'm probably going, I go to Buffalo every month or two to pick up stuff that I can't get in Canada. And I'm probably going on Friday. So I might, when I've had trouble like this, then I end up shipping it to Buffalo and
Right.
I'm going to pick it up there. But even that's a problem because, like, for example, if it's coming from Europe to the States, now the States is putting like a big tariff on on imported goods. So then
Right.
even though I'm not American, I end up paying the tariffs, and then it's
Right.
like it's crazy. Like I spent 50 on one thing. It was like 50% tariff. It was crazy. Anyway.
Yeah.
So yeah, it's just been. But you have a bunch of toothpaste you're still trying to finish, right?
Yes. Yeah. I've got my Boca
Yeah.
hydroxyapatite.
Yeah,
toothpaste.
yeah. Yeah,
But I
so
just,
it'll
I,
be
I, I
there.
just wanted, it's not urgent, but I wanted to try Dr.
Yeah,
Dom's.
you'll get it. You'll get it.
Okay.
It'll be
Thank
here
you.
soon, I think. I'll
Thank
follow
you.
up this week and see, because someone in the office helps me with that, so I'll get them to look into it.
Yeah. Are these presentations that you're doing every month, are they strictly surgical related, or can they be just in general how biological dentistry works, period?
No, I'm planning to, like, what I want to do is get all these topics, like get them down. Like, so last time was the cavitations. The first time we went over a patient's case start to finish.
I've watched all of
This
them.
was the implant. So like I basically want to try to go through different topics so that it's done and the recording's there. And then if someone wants to learn about a specific topic, then they can go look at the recording. And yeah, it's open-ended. Like I'm even planning for some future ones to bring on like a guest and like an expert in a certain area. Like this whole airway and breathing thing is such a big topic now, and especially for children's development. And so I have a couple of different colleagues that I'm going to bring on for that. And so yeah, it's just, we're going to have fun with it and have different topics, and it's overall health. And I mean, the idea is a Q&A. Like I want there to be a place for people to come on and ask questions and get their questions answered, and they don't have to come in for a consult in the office in order to do that. So that's the spirit. And then I just figure, okay, let's sprinkle in some different educational information. And it can be a variety of topics. It can be general health stuff too. It doesn't have to be specific to dentistry. But yeah.
Sounds great.
We'll
Well,
do-
can
I'll
you
probably
do
do one at some point on nutrition.
Yeah.
Hey, Lori.
Snoring when your partner snores? How will you get them to stop doing that?
Arsenic.
Short of that.
Yeah, no, we're gonna do all kinds of different topics.
That'd be great.
Like what's a topic of interest for you? I kind of need to know.
Yeah, I would say my two would be just like general biological dentistry that's not surgery related,
Yeah.
like the whole addressing of the general health of the mouth and cavity prevention, and then how cavities are
Did you see my other one? Did you see
treated.
the podcast one that I did?
Yes, I've seen all of them.
So that one I go over a lot of that.
Okay, I'll rewatch it again.
Like let me pull it up.
And then the other topic would be snoring, would be my interest.
Okay. That's good to know. Yeah, if anyone on here, there's a specific topic, please let me know because I want to cater these things to what the interest is. Like I did surgery this week because all the questions last month were all about implants. And I was like, okay, let me do a presentation on it. But yeah, the podcast one, there's a short version now. I don't know if like you don't need to bother with the long version, and so it's hour 15 minutes. Let me just show it here.
No, I did watch that one. I'll go back and watch it again.
Okay, let me
With everything that's happened since September, I equate it to like trying to drink water out of a fire hose.
yeah, but
Like,
you're
absorb everything.
I know, but you take it seriously, so you know you don't have to get a PhD in all this stuff. But yeah, like this one here, I have detailed information and all that.
Okay.
So the slideshow, you can see, you know, all these different things to focus on for trying to help with dental decay.
Mm-hmm. Okay, thank you.
So yeah, look for the one that's an hour and 15 minutes long rather than the 3-hour one.
Yeah. What's the difference between the two?
Well, I just cut out a lot of the conversation that was kind of not necessary. Like, you know, the woman who was interviewing me, she had a lot of questions and stuff, and some of them are good and helpful, so I left those in when I edited it, or other things were kind of off track. So, because I like people to watch this before they come see me for a consult, so I wanted to just trim it down as much as possible, so it's only the important information. But yeah, the long version, I mean, you're welcome to listen to it. It's there. It's on YouTube. You can see what it's about. But yeah, I just like to save people some time. So see, like here, we even talk about mouth breathing as being one of the issues for dental decay. Okay. So who's up?
So it's me, I guess.
Yep.
So this podcast on YouTube?
Yeah, like the one I just showed?
Uh-huh.
Yes.
On YouTube, okay. And where we can find it?
Show you how to find it. So if you go to YouTube and you type in my name, Julian Camastra,
okay,
then it comes up. And I've got quite a few different videos that are helpful, but
yes, some I watched actually, but not all of them, I guess.
yeah, like there's some on the mouth breathing.
Yeah. Yeah.
So I talk about different exercises to do with the tongue.
Yeah, that one I saw, yeah.
Okay. But yeah, the podcast is here. So it's King Hero's Journey podcast short version.
Yeah. Okay. Awesome. And where we can find the recorded ones? Like today, I'm guessing that is recording, that's right?
Yeah, they're all going to be on the website.
It's going to be on your website, yeah?
This new website, this Talkin Teeth website.
Okay.
Because you have to be a member.
Yeah.
So I assume you figured out how to do the membership?
Yes.
Yeah. So for the people who signed up, then all the recordings will be in the website.
Okay. Awesome. Thank you.
We can pull that up. my wife did it all. So
Sick person.
like if I click here, it brings you to this website here. Like, so I went to talkin-teeth.com, and then I clicked shop our services, and then I click this one, monthly Q&A, and then find out more. So that's how you all registered for this tonight. And then you would have set up a login. So then you log in, and then all the, like you can see here, September Q&A recording is here. And then here's the October one. And then the one from today, November, will be there as well. Can you see the screen?
No, we don't see the screen, Julian.
Oh, you don't?
No.
Really? Oh, that's why. Because it opened a new tab.
And how long does it normally take to post the recording?
A day or two.
Okay, great.
So do you see the screen now?
Yes.
Yeah, so here's the membership website. So you would log in, and then, like I'm just on the homepage, and you can see there's the recordings here, but there's another little platform. I think it's kind of set up like a course. So, but yeah, you should be able to get to the recordings from the first. Yeah, they're there.
Yep.
Perfect. Does this screen show?
Yes.
Yeah, so it'll show up like this. So it's like a course. So this is the September one, and then I'm not logged in, so I can't see the October one, but it should be there, and then the November one will show up here. And I'm probably gonna put all the other links too of the relevant videos into here, so it's just all in one place, easy to find.
Oh, that would be great.
Yeah.
Thank you.
Yeah.
Dr. J, can you post the picture? You kind of posted it real quickly, and it was the do's and don'ts of what to do around an implant. You put it on, and then you switched immediately to titanium. But it was like something like you printed out, I think, to give to people or something.
Yeah, I should upload that. I'll upload that PDF into the course too.
Okay. Yeah, it was like, so for instance, we're not allowed to even use dental floss the entire 4 months it's healing.
Well, you got to just be careful. You can use it gently. I don't want it to go down in below the gum around the implant.
Okay. Okay.
Where was I showing that? Here.
Oh, by the way, I did find a dentist on the link that you provided for the people who use the biofilm cleaning.
Yeah.
And that dental office did not follow through for the last visit to apply the crown. You had to go to a different office. And they also had no idea they did not use ozone.
But yeah,
She said-
that's separate. I would just go to an office like that for cleanings.
Oh, she said, yes, we just use a saline solution. I'm like, no.
But
Interesting,
for
huh?
For the cleanings, it's okay. They're not going to, like, just because they use the GBT cleaning doesn't mean they're going to do the ceramic implants and everything. Yeah.
Yeah, I went through a lot of rigmarole to try and find someone, and I did not ask about the piezoelectric. I'm so mad.
Why don't you just come up and see us?
I have family in town. You're freezing cold, and I have
told
to
you
do
I
it.
was sun tanning yesterday.
Plus, how's it going to feel to travel after surgery like that? You know, I mean, I'd rather be up there when my friend is up there and I have a place to stay for a little bit. You know, it's
No, I don't know.
Yeah, it's scary. It's scary to just hang out in Canada in the middle of winter by yourself.
It's not the middle of winter. I told you.
I have the heat on it in Florida right now
Oh my
because it's so cold. Anyway, I will be
Yesterday
able
was
to.
beautiful. I was literally like, wearing very little, tanning in the sun, and it was like summer.
Yeah. Your blood is not as thin. When you live in Florida, your blood
I'm
thin.
Italian. I'm Southern Italian. We're like, it's the same.
Calabria. But no, I will come up. I was thinking to just have this extraction done, and then as it heals, then I can come up and we can take care of the other tooth and the cavitations and the mercury, and I could do it all properly planned instead of
boy.
stressing before Thanksgiving, That was my way of thinking right now.
All right.
Yeah, but I look forward to it, and I don't trust anyone else at this moment from learning all of this. It's kind of
No,
It's
there's
insane.
people out there you can trust for sure. Just, yeah, there's certain things you want them to be implementing.
Yeah, for sure, for sure. Okay, thank you.
Okay, no problem. Good luck. Is there anyone else?
No, it would just be great if you could upload that, the guide to implant maintenance.
Yeah, I am going to. I'm just doing that right now.
Yeah, fantastic. But thank you so much.
Yeah, I know, it's
Yeah.
nice to have everything in one place. Like, I mean, the Telegram group, I have a lot of that stuff. But yeah, I'll work on populating all that into this new website, and it'll be nice resource.
I'm not on Telegram, so
Okay, yeah, don't worry about it.
yep.
What do you say about CPAPs and teeth?
Was that Lori?
Yep.
How's it going?
Good. Nice
That's
to
good. How have
see
you been? I haven't seen you in a while.
Yeah, it's been a while. Yeah. I'll
How-
probably see you soon.
Yeah, how you been feeling?
Yeah. Not good. Yeah, I've been struggling with some health things, so
Oh no.
that's why I haven't been in, but I have to come in.
So sorry, I'm just trying to upload this document quick. CPAP. Are you on a CPAP?
Yeah, I fantasize about getting off of it.
And why? Like, what don't you like about it?
This was years ago. I don't know. I just don't. I have these scan things done, nest scans, and it always comes back that my lungs are weak. And I just wonder if that's, kind of like using a crutch. I don't know. I just wonder, you hear about MRSA and stuff and equipment, and I do clean my stuff, but, I don't know. Be kind of
Yeah,
nice to just
I
be
mean-
able to lie down or go to someone's house and be able to go to sleep without having to bring a bunch of luggage,
Did we ever talk about the expansion stuff? I think weren't
You have
going with
mentioned
your daughter?
that.
Didn't
Yeah,
I
my
recommend something to you and your
daughter was,
daughter?
yeah,
Your daughter was doing it.
yes, yeah, she was doing it with some kind of mouthpiece. Mhm.
So yeah, that's the alternative. Like the CPAP is just trying to force air down there. The alternative to try to change the underlying structure to make it bigger, and that's what the expansion does. And so it can be done in adults. So I mean, those are the different options. CPAP's not. It's not fun. It's not ideal. Like if it were me, I would try to figure out some other solution than to CPAP.
Well, I got a lot many years ago, and I feel like it was a medication issue more than anything because, and maybe weight, which I've lost a bit of weight, but I'm not on as many medications anymore. So a lot of times my reading says that I've hardly had any at night, any apneas.
Okay.
I was getting zero like quite a bit, which is
Good.
what got me thinking, oh, maybe I don't really need it anymore. It always feels weird if I do end up sleeping without it, which rarely happens, but I don't know if it's just because I'm used to it, but I wasn't sure, my mouth doesn't get terribly dry. I actually devised my own chin strap so that my mouth stays closed, and I do wear a night guard. And I wonder about the night guard too. It means plastic.
I know. Well, yeah, we make nylon ones for people now that are a little nicer and they leach less. They're pretty hard material and they don't wear off and rub off so easily. So that's kind of where we're going with that. But yeah,
it's very comfortable and everything.
Yeah,
but it's old. I've had it for years.
okay. Yeah, you look skinny.
No, hardly, but
How much weight did you lose?
so far about 40 pounds.
Wow, good for you. That's not easy.
Thank you. Yeah, it wasn't too bad. I just
Good.
changed my diet,
Yeah, going for walks and stuff.
Not a lot because I have this back issue, but yeah, mostly diet.
What are you eating?
A lot of vegetables.
Yeah.
Yeah. I'm not a big eater. I lost my sense of taste and smell quite a few years ago, probably about 12 or 15 years ago. So eating was more for texture than anything. So, I mean, it makes it easier when you're not, I don't get cravings for tastes anymore. Right?
Yeah.
If I might suggest, Lori, you might want to look at yoga for your back and any other.
Yeah.
Yoga is a great practice.
Yeah, I've heard that before, actually.
Okay, I have a suggestion for you as well.
Mm-hmm.
Have you ever heard of MMS or CDS?
I just started it again.
There you go. Yay. Good job. Good job.
I was on it for an entire year and I was doing really great, feeling really good. So I went off it thinking that I could, and raging infection took me over, and now I'm trying to dig out of that.
By completely stopping it?
Well, I guess what happened was it was dormant. It was holding it down. The CDS was holding it down. And then as soon as I stopped it, it just flourished again.
Yeah, I bet. It's the only thing that saved me from my tooth all these years. How about, can I ask what how many drops were you taking per day when you were taking it that whole year?
I had built up to